Assalamu alaikum warahmatullahi wabarakatuh. Brothers and sisters, I wanted to give you an update on the coronavirus situation and the difficult decisions we've had to take recently. As you know, this virus is rapidly spreading across Europe, and the prediction is that the UK is about 3 weeks behind. We are expecting huge rises in cases, and it's extremely important that you listen to this advice. Let me first dispel one myth. This is far more than just flu. People have been underplaying this condition, and I'm extremely worried about your welfare and that of your loved ones. This virus has 50 times the mortality rate of flu. We know that the elderly are particularly affected and those with chronic health conditions. In the Muslim community, we have a far greater percentage of the elderly that live with us and those that have heart conditions and diabetes. We are more likely to be affected. You may not know, but the first 10 deaths in the UK, 4 of those were Muslims. So please listen to the advice. There's 2 ways you can reduce the spread of this infection. One is through social isolation, and the other one is through implementing measures for social separation. That's why the recommendation is now to close the masjids, to stop the Jummah Salah. It's likely in gatherings which reach in some masjids several thousand, you will spread this virus between you and then take this into your homes and affect the elderly and those with chronic health conditions. I appreciate it's difficult. These measures are difficult, but the community must listen and change the way it interacts on a daily basis. This is affecting all of us, but we must slow the spread of this virus. Let me give you a hypothetical scenario. Our local hospital cares for 465,000 patients. If we assume 80% of those infected will be okay, this will still lead to about 93,000 hospitalizations. If we assume then a small proportion of these require ventilation, that's about 4,000 patients. Imagine if these 4,000 patients all need ventilating in a very short space of time. This will not be possible. Hence why we need to slow the spread of this virus so that we can allow time for the local healthcare facilities to cope with this infection. Please listen to the health advice from the UK government and follow this on the NHS website. If you have mild symptoms, please self-isolate and manage yourselves at home. If you have severe symptoms, then please visit the NHS 111 website and follow the advice on the website.